are so excited to welcome to the stage a recent Ben Venture Conference winner, Health Elements AI, for a company update. Joining us on stage tonight is Russell Authur. He is a technologist, AI engineer, and entrepreneur. Russell is the co-founder and CTO of Health Elements AI, which spun out of the Paul Allen Institute of AI to make high-quality healthcare more accessible and affordable. Health Elements automates the abstraction of health data from the electronic health records using cutting-edge LLMs, supporting important quality improvement processes while alleviating nurses from a massive data entry burden. Welcome to the stage, Russell.
And I think that's the company update. Thank you. No, just kidding. Hey everyone, I'm Russell. So I'm the CTO at Health Elements. Very excited to be here. I will say I don't get out very often. I'm supposed to kind of stay inside in my closet and write code and do things with AI all day. So very excited to be here. So thanks for the intro. So at Health Elements, we basically use AI to help hospitals with this kind of crushing amount of administrative work that they have to do today. So, if you go to the hospital and you have a heart procedure, if you have surgery, there's typically a nurse that's going to read through your entire record after you leave and literally do data entry of hundreds or thousands of data points about the care that you receive at the hospital. So we use AI, now large language models. Other people have tried this in the past with traditional NLP and it just hasn't worked. But now we think with LLMs, we can finally attack this problem head on and start to make progress towards automating it. So when you think about data abstraction at large across healthcare, that's like $1 trillion labor cost to the US economy. So we're starting in a specific area, which is clinical registry reporting. So again, reporting on those procedures that you actually have in the hospital. But the kind of reach of this data abstraction automation is massive and touches kind of all domains of healthcare. It could be payers, it could be providers, hospitals, everyone. So our first hospital launch partner is actually a small healthcare system in Southeast Georgia. So they're a multi-hospital system focused on cardiology procedures. So they're using our certified platform now to do data abstraction for a patient population that includes thousands of these cardiology procedures per year. So right now, a single patient can take 1 to 2 hours to kind of do this reporting task. With our software, they think that they can reduce that by 80%. So they've already been using the system since January. We're live, we're fully integrated with their Epic EHR system, and we're seeing AI accuracy results that are over 90%. So we're either meeting or exceeding the accuracy that their human nurses are getting when they're doing this task now. So as you can imagine, to process thousands of patients, they have a team of 7 or 8 people who are clinically trained, who are nurses, who are spending their kind of days doing this data entry task when they could be instead spending time with patients or actually focused on improving the quality of care that patients are receiving. So that's kind of feeds into our mission and really where we want to make an impact at Health Elements. So really excited about how that pilot's going. That's kind of our really heads down work right now, and we think we'll be fully live in their kind of entire workflow in Q2 of this year. So, I wanted to just also touch on a couple challenges that we have. One is healthcare data is highly regulated, right? So the way that you have to get access to data, the way that you store data, all of this is kind of controlled. So, technically, there's a challenge there. And there's an additional challenge in that even though like access is being opened up now, it's not universal across health systems. So, when you think about reading a patient record, it's not as simple as walking into a hospital and saying, hey, give me a PDF of your patient record, and then going to, letting the AI basically go to town on that, right? So, there have been advances there that have made a difference. Things like FHIR is a keyword that you'll kind of hear thrown around a lot in healthcare, but it's not universally adopted. But, now we're starting to see, and we're really building for the kind of next generation of data warehouses. So those are things like your Databricks, your Snowflakes, where hospitals are starting to transition their underlying data, their underlying patient data to these systems. So that really helps us shortcut the privacy concerns and other things, because now we can think about taking our solution and running it entirely within the data warehouse of the hospital. So we're no longer responsible for storing and processing that patient information. And on top of that, like using AI to actually try to automate something is its own unique challenge, right? And luckily our team has an extensive background working with clinical registries, both on the kind of data entry and clinical side, as well as on the technology side, in terms of how the data is collected, where it needs to go, and validating all the data that any AI is extracting. And then, the other kind of challenge that we have is the healthcare sales cycle can be super long, and that security review process is a big part of it. But there's also just a ton of stakeholders that you have to convince. But we've been really fortunate to get conversations with kind of key stakeholders at companies, at hospitals, because everyone's interested in AI right now, and everyone wants to understand how they can use AI to automate this kind of massive amount of administrative work that they're doing. So that's been great for us, and we're really looking for like partner number 2 right now, and that's going to be something I'm sure we'll close out in the next few months. Yeah, and in terms of what else is next for us, we are hiring right now. I think mainly on the engineering side. So if there are folks that are interested in AI engineering, large language models, healthcare data, privacy, anything like that, please do come say hi afterwards. Yeah, and that's us. Thanks.
Amazing. Thank you. That was me. How about another round of applause for Russell?